Okay, good morning everybody. Today we will talk about the muscular system. Muscular system consists of the skeletal muscles of your body. So we will talk about the skeletal muscles. First, we'll see how we group the muscles based on the functions. That is the functional groups of muscles. Then we'll see how we name different skeletal muscles. Then we'll talk about the muscle fibers or fascicles, the arrangement of the muscle fibers or fascicles. Then we'll talk about the skeletal muscles of the body in different areas of your body. We'll talk about the skeletal muscles of the face. We'll talk about the muscles of the chest. Chest muscles or thoracic muscles are divided into two groups, respiratory and non-respiratory. So we'll talk about that. We'll talk about the abdominal muscles, muscles in the abdominal wall. Okay. We'll talk about the pelvic muscles. Pelvic muscles form the floor of this pelvic cavity. You know, this is the pelvic cavity. Remember, everybody, this is the pelvic cavity. So you see a big opening here. So this big opening is closed by the pelvic floor. So which muscles form the floor of the pelvic cavity? Then we'll talk about the muscles of the back of the trunk. Then shoulder muscles and upper and lower limb muscles. Okay? First, the functional groups. Based on the functions, we divide or group the muscles into four types: prime movers, antagonists, synergists, and fixators. Prime mover is the main muscle for a movement. Okay, so you see here, if I do the flexion of my forearm, this is the flexion of the forearm, right? Everybody following? This is the flexion of the forearm, right? These muscles cause the flexion of the forearm. Always remember, the muscles above the joint will move the part below the joint. So these muscles above this joint will move this part towards them. Muscles always move towards them. Make sense? Okay. So these muscles will do what? Towards them. These muscles towards them. Make sense? These muscles this way. These muscles this way. So muscles work on the body part below and move towards them. So now, these muscles will do what? Flexion of the forearm. Now, you know there are three muscles here: biceps brachii, brachialis, and brachioradialis. All have brachii. So, biceps brachii, brachioradialis, and brachialis. Three muscles help in the flexion of the forearm. Make sense? Because all three are here. Now, which one is the main one? Provides maximum force or most of the force. That is called the prime mover. Antagonist is the muscle that work in opposite direction. So this is the flexion of the forearm. These muscles will do what? Extension, because we'll move towards them. So these are the flexors, these are the extensors. So the muscles act against or in opposite direction or reverse direction of a particular movement are antagonists. So in this case, triceps muscle is the antagonist of this movement. This is the flexion, right? So who are helping? These muscles. Who are moving in opposite direction? This muscle, triceps. Make sense? So this is the antagonist. Now you tell me, it is a little bit tricky. If I it is important that which movement I am talking about. If I talk about the extension of my forearm, this is the extension, right? So who is the prime mover for extension? Triceps. Who are the antagonists? These muscles. Okay. So these muscles could be a prime mover or antagonist depending on which movement I am talking about. Did you get it? So if I talk about the flexion of the forearm, these are the prime movers, right? These are the agonists and these are the antagonists. We talk about this movement. This is the agonist. This is the antagonist. Okay. Synergists. Synergist is a muscle that provides less force, help the main one or assists the main one. So the helper, like you and your small child both are trying to move a furniture from one place to another place, okay? So you are the prime mover, make sense? Main mover. And your child is a synergist, helper, make sense? So you are providing 80% force, your child is providing 20% force, make sense? So synergist. Fixators. There are some muscles that run around the joints and help to prevent undesirable movement of the joint. Now you say, look at this, you will understand. I am trying to do flexion of my hand. This is the flexion of my hand, make sense? So these muscles, anterior forearm muscles are doing that, make sense? Flexion. Now, when I am doing this, there is a chance that my hand will also move sideways, right? But that is undesirable. I don't want that. I want to move this way. Make sense? But there is a chance that slight sideways movement can occur, right? So there are some muscles going like this and they are trying to stop that. Stop the undesirable or unwanted movement. Make sense? So those are the muscles called fixators. So those are 4 groups of muscles. Now, naming of the skeletal muscles. How we name the skeletal muscles? We name based on a number of things. We name, some muscles are named by location, some are named by shape, some are size, direction of fibers, number of origin, location of attachment, and action. So we name different muscles based on different things. Location. You all know that a muscle here that is called temporalis, and we know that this is the temporal area, right? Temporal area. Frontalis, remember? So this is frontal area, we know that, right? So those are named after the location, exactly, where that muscle is located. Shape. This muscle is called deltoid, triangular muscle, okay? In the back, you have a big muscle, trapezius. Remember that? Tight shaped, trapezoid shaped muscle. You have rhomboideus, rhomboid shaped muscle. Make sense? So those muscles have been named after the shape. Deltoid, rhomboideus, trapezius, those are the muscles. Relative size. You have here gluteus maximus, gluteus medius, gluteus minimus. 3 gluteus muscles are here in the back, right? Maximus is the biggest one, medius is the medium-sized one, minimus is what? The smallest one, right? So relative size. We name some muscles based on the size. Direction of fibers or fascicles. If you see, the muscle fibers are round like this, like around your eye, around your mouth. The muscle fibers are like this, circular. That is called orbicularis. Orbicularis, you know, orbicularis oris, around the mouth. Remember that? So that is based on the direction of fibers. Circular means orbicularis. External oblique. There is a muscle here called external oblique. Why? Because the fibers are going like this, oblique. Transversus abdominis, the fibers are going transversely. Make sense? So, based on the direction of fascicles or fibers. Number of origin. we know that biceps, bi means what? Two, right? Why we say biceps? Because this one has two origin. Triceps, three. So some muscles are named by the number of origin, by location of attachment. Good example is this one, Sternocleidomastoid. This muscle, you see here, this muscle, when you turn your head, you can clearly see, this muscle has two lower ends and one upper end, like this. One is attached to the sternum, another lower end is attached to the clavicle, that's why sternocleido means clavicle, and mastoid process of temporal bone is here. So this muscle is named after those three attachments, sternocleidomastoid. Action. Many muscles are named after or by their actions. For example, flexors. There are many flexors, right? Flexor carpi radialis, flexor carpi ulnaris, flexor digitorum, extensors. They do extension, right? Extensor carpi ulnaris, extensor digitorum. We have abductors. Do what? Abduction. Adductors. Make sense? So those muscles, many muscles are named after their actions. Pronators, supinators. So those are the ways how we name the skeletal muscles of the body. Here you see different arrangement of the muscle fibers or fascicles. I have already mentioned the circular, top left you see orbicularis oris. Okay. Below that you see the muscle fibers are parallel like this. Good example is sartorius. Sartorius is a muscle like this here, and the fibers are going side by side, parallel to each other. Then unipinnate, bipinnate, multipinnate. What is that? You see here, this is the tendon. Okay, muscle subtendon. So this is a tendon, and if you see the muscle fibers are present in one side of the tendon. So these are the muscle fibers. So this is actually the muscle, and this is called unipinnate. From one side of the tendon, muscle fibers. It's like leaf. You know the leaf in the plant. We say unipinnate leaf, bipinnate, multipinnate. Very similar. Okay. So if you see the muscle fibers are present in both sides, this is called bipinnate. Okay, both sides, two sides. If you see there is more than one tendon, another tendon is here, so two tendons here, and muscle fibers here. So this is multipinnate. Okay, so unipinnate, bipinnate, multipinnate. We have those types of muscles. You see here, unipinnate. This is the tendon. Okay. Then convergent. You'll see some muscle fibers are coming from different directions or different locations and getting together at one point. So coming from different points or different locations, but getting together at one point. So this is called convergence, coming from different directions but meeting at one point. This is convergent type muscle. Okay. Example is Pectoralis Major. You have a muscle here. What happens, you see, you have several ribs, right? You have the ribs. So the muscle fibers start from the ribs and get together here. So it's like this. Okay, so that is convergent pectoralis major. So those are, another is fusiform. In case of fusiform, we see the muscle spindle or muscle is like eye. Both ends are pointed. Middle part is wider. So fibers are like this. Middle part is wider, ends are pointed. So those are different types of arrangement of the muscle fibers. So different muscles have different arrangement of fibers. Okay. Now we will see the cranial and facial muscles. Cranial muscles are temporalis, occipitofrontalis. Those two are the cranial muscles. You know temporalis are here, right? In the temporal area, and occipitofrontalis. Occipital belly and frontal belly. They are connected by a white sheet that you have seen. That is called gala aponeuretica. Remember that? Or also called epicranial aponeurosis. So gala aponeuretica or epicranial or cranial aponeurosis. This muscle helps to move the scalp slightly. We can move the scalp a little bit forward, backward with the help of occipitofrontalis. Slight movement. Okay. Facial muscles. There are a number of facial muscles. They help in facial expression. You know facial expression, when you get angry, your face, right, changes. When you are happy, your face changes. Right? So those are facial expressions, right? So these muscles, some of these muscles help in facial expression. Some of these muscles help in mastication, movement of the mandible to chew the food. So those are the muscles of mastication. So and also some muscles help to production of speech, help in production of speech, because mandibular movement is needed for that. So what are the facial muscles? Orbicularis oculi. Orbicularis means what? Round, right? Oculi means eye. So around your eye, the round muscle is orbicularis oculi. Levator labii superioris. Levator labii inferioris. Labii indicates lip. Levator pulls up, depressor pulls down. Okay? Superioris means above, inferioris means below. If you know these things, it is very easy to identify the muscles. Okay? If I say levator labii superioris, you will look around the lip, first thing, right? Because lip, labii. Superioris means what? Above or below? Above. So you will not look below the lip, you will look above the lip. Make sense? If I say inferioris, you will look below. Make sense? So if I say depressor, that means it will move downwards. So it is below. If I say anguli, that means angle. So remember those few things, that will be helpful. Zygomaticus major, zygomaticus minor. Both are attached to the zygomatic bone, cheekbone. So if you see, those muscles are attached to the cheekbone, zygomaticus. Okay? The bigger one is major, smaller one is minor. Buccinator. Buccinator is the muscle here, when you do like this. Okay, the depressed area. Buccinator. Also say vaccinator. In Europe they say vaccinator, here we say buccinator. Orbicularis oris, round, around the, oris means oral mouth. Masseter is the strongest muscle of the face. When you clench your teeth, that is the muscle gets very strong. You can feel here, right? Clenching muscle. you break something, very hard using this muscle. Strong bite. Depressor, as I mentioned, if you see depressor, that means it should be below because it pulls down, depresses. Anguli, angle of the mouth. So, like this. This is the angle of the mouth, and depressor is like this. So, risorius is the smile muscle. When you smile, what happens? The mouth widens. So, risorius are like this. Pull the mouth from both sides. So, mouth widens. So, those are the muscles in your face. Orbicularis oris is called kissing muscle. Round muscle around your mouth, kissing. So here you see temporalis, cranial muscle, occipitofrontalis, occipital and frontal belly connected by white sheet, that is galactoneuretica, and also see the facial muscles. Now let's quickly review again. Two circular muscles, orbicularis oris, orbicularis oculi. Okay. Now you see here, this is levator labii superioris. It has two parts. Why called levator labii superioris? Because labii lip superior above the lip. Okay, and it elevates the lip, moves the lip upwards. Lifts. Opposite is depressor labii inferioris. Inferior labii, lip below, and it depresses, pulls the lip downwards. Okay. See here, depressor anguli oris attached to the angle of the mouth, and it moves the mouth downwards. Mentalis. You all know this is the mental area, right? Makes sense? So if you see the muscle here, mentalis muscle. Zygomaticus major, the big one, minor. This is the zygomatic bone. So two are attached to that bone. Okay? Major, minor. This is buccinator. Only a part of it you can see, because if you remove this muscle, then you can see most part of it. It is a big muscle, but hidden under this muscle. Okay? So that is the buccinator. This is the strongest muscle of the face, masseter. Strong bite is helped by this muscle. Another muscle you see here that wraps down from the mandible. This is the mandible here, lower jaw. It is a thin muscle that covers the anterior neck, front of the neck, like this, goes down like this, and that is called platysma. It is a thin muscle, covers the whole anterior of the neck. This one, platysma. Okay. Sternocleidomastoid, I have mentioned. This is another neck muscle, sternocleidomastoid. We'll talk about neck muscles. Just know the cranial and facial muscles. Okay? Yeah. Four muscles, or four pairs, four in each side of the face, belong to the muscles of mastication. So four in this side, four in this side. Okay? Which four muscles are the muscles of mastication? Temporalis, masseter, medial pterygoid, and lateral pterygoid. Temporalis is here, you know that, but what happens, look at this. This is the temporal bone, temporalis is here, but the lower end of temporalis go to the upper part of the mandible, because this is the mandible, we know that, right? Upper part of the mandible. So this muscle goes to the mandible and helps in the movement of the mandible. So that's why it is mastication or chewing muscle, because it moves the mandible. Makes sense? Those muscles move the mandible. Those are the muscles of mastication. Masseter, the strongest one, I told you, strong bite. So that is another. And two pterygoids. You did not see pterygoids here in this picture. Why? Because pterygoids, to see pterygoids, you have to remove all these muscles. Those are very deep. Okay? in the face. So if you remove all these muscles, then you will see pterygoids. You can only see two mastication muscles here. Temporalis, you see the lower end goes to the mandible, and this is the masseter. Medial and lateral pterygoid, you can see only once you remove the superficial muscles. So these are the pterygoids. Medial pterygoid, lateral pterygoid. Okay, so these are four muscles of mastication: masseter, temporalis, medial, and lateral pterygoids. Okay? You see, all are attached to the mandible. Must be, because to chew the food, you need the movement of the mandible. Okay, now the muscles help in the movement of your tongue. Movement of tongue is very important, you know that, right? We move the tongue a lot. So, which muscles help to move the tongue? There are several muscles for the movement of the tongue. One thing, if you remember, would be very helpful. Most of the tongue muscles that help to move the tongue have glossus in it. Glossus. Glossus means tongue. Okay? Like styloglossus, hyoglossus, genioglossus. Okay? So, if you see the muscle ends with glossus, that is the muscle for the movement of the tongue. I may ask you in the exam that which one is helping in the movement of the tongue. If you see glossus at the end, definitely that. Okay? They go from different directions and get attached to the tongue. So that's why you can move the tongue in many different directions. Very interesting organ of the body. You can move in many directions. Muscles of the front of the neck, anterior neck muscles. Here, you all know, I mentioned before, that this bone, which bone is this? This one? Hyoid, right? And I told you that hyoid bone supports the anterior neck muscles. Remember? Because this is the only muscle here, right? In the front of the neck. So, your anterior neck muscles are supported by hyoid bone. Make sense? So, that's why most of the anterior neck muscles have hyoid in its name. For example, homohyoid, sternohyoid, stylohyoid, mylohyoid. All those are supported by hyoid bone. That means get attached to the hyoid bone. Okay? So most of the anterior neck muscles end with what? Hyoid. Is it clear? Most of the tongue muscles end with what? Glossus. Glossus means tongue. Is it clear? Okay. There are a couple of exceptions. You remember I have already mentioned a thin muscle covers the anterior entire of the neck that wraps down from the mandible. That is called platysma. It is not attached to the hyoid because it is very superficial. Then sternocleidomastoid is not attached to the hyoid. So its name is not, hyoid is not added to its name. Okay, so those are the anterior neck muscles. Posterior neck muscles, the back of the neck. Here also there is a trick. If you see, the name starts with splenius, back of the neck. Splenius capitis, splenius cervicis. Okay, so those are the anterior neck muscles. And muscles of the vertebral column. The muscles around the vertebral column help to keep the vertebral column straight. It is very important, you know that. You have to keep your vertebral column straight, right? To keep the body erected and straight. So, which muscles help to keep the spine erect? That is called erector spine. Makes sense, right? To keep the spine or vertebral column erect or erected. So, erector spine. So, erector spine is a group of muscles. It is not a single muscle. Inside erector spine, you will see three muscles are inside it. You have to remember iliocostalis, longissimus, and spinalis. Those three muscles are around the spine. Iliocostalis, longissimus, spinalis, and these three together is called erector spine. Now, the names make sense. Why? Because you see, first let's say iliocostalis. You remember ilium of the hip bone? Ilium of the hip bone is this, right? This one, ilium. And costal indicates what? The ribs. Costal. So, iliocostalis. Makes sense? But in the back, of course, because this is the vertebral column, spine. Okay? So, from the vertebral ilium here to the ribs. Iliocostalis. Spinalis. You see? Spinous process. These are the spinous processes. You all know that. So, the muscle attached here. Spinalis. Makes sense? So, ilium is here. Costalis, ribs. In the back. These are the ribs. This is the ilium. Spinalis attached to the spinous processes. Okay? And longissimus in between. Muscles of the thorax. This is the thorax, and in your thorax there are two types of muscles, respiratory and non-respiratory muscles. Make sense? Respiratory and non-respiratory. Which muscles are respiratory muscles? Intercostals. Intercostals. External, intercostals, and internal intercostals. Inter means in between, costal means what? Again, I just mentioned 1 minute ago. Costal means ribs, right? So intercostals means what? In between the ribs. Make sense? So intercostal muscles are here. Now there are two. So the muscle is like this. You see, this is one external intercostal. This is internal intercostal. Make sense? External and internal intercostals, and they help to move the ribs during breathing. You need to move the ribs, right? You know when breathing occurs, the ribs move. So intercostals are respiratory muscles. Diaphragm. Diaphragm is here. You know that. That separates thoracic and abdominal cavity, the flat muscle. Diaphragm is a muscle, remember. Here under the lungs. So those two muscles are the respiratory muscles, right? Other muscles, they have either very little or no contribution to breathing or respiration. So what are the other muscles? The main one in the chest, the big one, the largest one here is called Pectoralis Major. Pectoralis means what? Chest. The word pectoralis means what? Chest. So pectoralis major, under that you have pectoralis minor, right? You have serratus anterior. Those are the muscles belong to non-respiratory group. Here you see intercostals in between the ribs, okay? External and internal. Muscles of the abdominal wall. In the wall of your abdomen here, you have 4 muscles. in the abdominal wall. These muscles are internal oblique, external oblique, transversus abdominis, and rectus abdominis. All these muscles are named after the direction of fibers. Direction of fibers. Make sense? You see, external oblique. Here, external should be outer or inner one? External. Outer, right? And internal, inner. Make sense? So you have two oblique, but they are like this. You see, external oblique is the outermost one here in the abdominal wall, and the fibers are going like this. Oblique. Make sense? Then under that you have what? Internal. But remember, this is oblique, right? Agree? This is oblique, right? This is what? Also oblique. Make sense? This is also oblique. So external oblique muscle fibers are going like this. Internal oblique fibers are going like this. Make sense? But both are oblique, right? And then under that, under those two, you have another muscle, fibers are going like this. This is what? Transverse. Make sense? So transversus abdominis. So those three are here at the side of the abdominal wall. And in the middle, you have a muscle like this, going like this. Rectus. Rectus means what? Straight. Okay? So rectus abdominis in the center. Three muscles at the sides. External oblique or obliquus, internal obliques, and transversus abdominis. Transverse. Now, abdominal muscles help in the movement of the trunk. You know, if I want to move the trunk of my body, these muscles help. These muscles are going in different directions. So when the muscles work, they move in their direction of their fibers. So external oblique will move this way, internal oblique will move this way, transversus abdominis will move this way. Make sense? Like this, transversus abdominis, right? If I want to move this way, make sense? External oblique, want to move this way, internal oblique. So that's how rectus abdominis, that's how we can move the trunk in different directions, because the fibers of these muscles have different directions. Abdominal muscles also help in forceful breathing. You all know that when you do exercise, thoracic muscles are not enough, right? So you use the abdominal muscles. Or when you run, right? You need to use the abdominal muscles. Urination, to push the urinary bladder. Make sense? To expel the urine out, you need abdominal muscles. We squeeze the abdominal muscle. Defecation, parturition, for childbirth, you will hear the doctor say push, push, okay? Push using what? Abdominal muscles. Make sense? So, coughing, sneezing, those are helped by abdominal muscles. Screaming. So here you see the abdominal muscles. External oblique, you see the outermost one, fibers are like this. Internal oblique, fibers are in opposite direction. Transversus abdominis, and this is the rectus abdominis. Okay, six pack, you say that's rectus abdominis, and two rectus abdominis are connected by, in the midline, by this white line. That is the linea alba. Muscles of the pelvic floor, which is also called pelvic diaphragm. I mentioned at the beginning today. You see here, this is a big opening here. And the muscles close that opening are levator ani and coccygeus. These are two muscles. There is another muscle that is called piriformis. If I ask you what are the muscles of the pelvic floor or pelvic diaphragm, these are the muscles here that closes this big outlet opening. So here you see you are looking from above like this. You are looking the pelvic floor here. Okay. So which muscles you see? Levator coccygeus. So this is levator, this is coccygeus, and another muscle that is called piriformis. So write it down. These are three muscles: levator, coccygeus, and piriformis form the pelvic floor. Now you see that these muscles are around the important openings of your body. What are those openings? Urethra, vagina, anal canal. Okay, so those openings remain constricted. Make sense? Remain what? Constricted by those muscles. If those muscles get weak, those openings will get weak, right? So it will be difficult to hold the urine, right? Or hold the stool. That can happen in old age when someone's motor control is lost, the muscle tone is lost. But normally, these muscles, right, around the openings will keep the openings constricted. That is very important to know. Pelvic floor also, I have mentioned, seals the inferior outlet of the pelvic, support the pelvic organs, because you know your pelvic organs like urinary bladder, uterus, right? Those organs are here, so they are supported by the pelvic floor. Lift pelvic floor to help release of feces. So when you do defecation, you lift or contract the pelvic muscles, pelvic floor muscles that lift the pelvic floor and that helps to release the feces. Resists increased intra-abdominal pressure. When you see, this is interesting. Sometimes we increase the pressure in the abdomen for sneezing or other purposes, vomiting. We increase the pressure here. So when the pressure increases here, that pelvic floor moves down to reduce that or minimize that pressure. So it can move up and down. So those are a few important functions of the pelvic floor and how the pelvic floor is formed. Which muscles form the pelvic floor? Those three muscles: levator, coccygeus, and piriformis. Okay. Here, this slide is off. We talked about the thoracic muscles, respiratory and non-respiratory. So respiratory muscles I have mentioned, intercostals and diaphragm. And these are non-respiratory muscles. The main one in the chest is pectoralis major, I have mentioned. Under that, if you remove the pectoralis major, under that you will see pectoralis minor, the smaller one. Both are chest muscles. And then serratus anterior, I mentioned the name. Serrated, attached to the ribs like this. You know serrated knife? You have seen that, right? You can open like this. So serratus anterior. Serrated. So split. So those are non-respiratory muscles. Posterior of thorax, that means the back of your trunk. In the back of the trunk, you have, you see, this is the back of the trunk, right? Back of the body. In this side, they did not remove any muscle. In this side, they have removed these superficial muscles. So, first let's see the superficial muscles. The largest one in the back of the trunk is going like this. In this side, they have removed it. So you can see one half, and another half is like this. This is a kite-shaped muscle, and that is called trapezius, trapezoid-shaped muscle, large muscle. This is another in the lower part of the trunk, that is called latissimus dorsi. Dorsi means back, dorsal, latissimus, dorsal. So those are two large superficial muscles in the back, trapezius and latissimus dorsal. If you remove those two muscles, you will see some deeper muscles. What are those? You see levator scapulae. Attached to the lower end is attached to the scapula. This is the scapula. And when this muscle contracts, it moves the scapula upwards. So look at me. This is the action of that muscle. Make sense? Lifting the scapula. Okay? So that's why it is called what? Levator scapulae. Lifting the scapula. So it must come from above and attached to the scapula. Rhomboideus major, rhomboideus minor, or rhomboid major, rhomboid minor. The bigger one, both are rhomboid shaped. Supraspinatus, you must remember the spine of the scapula in the back. This is the spine, right, of the scapula. So supraspinatus is above the scapula. Infraspinatus